Hello students, this is Perio, Chapter 28, Lecture 1. Systemic delivery of chemical agents. Systemic delivery means administering chemical agents such as an antibiotic in the form of tablet or capsule. The chemical agent is then released as the tablet dissolves, enters the bloodstream, and circulates throughout the body. Local delivery in dentistry means placing a chemical agent into the mouth directly on an area such as into a periodontal pocket. The examples are toothpaste containing chemical agents that can kill bacteria. Examples of chemical agents used in periodontal patients include systemic tablets and capsules or local and topical agents such as mouth rinses, toothpaste, subgingival irrigation with a water pick, as well as controlled release delivery devices. The extracellular slime layer prevents chemicals from contacting and killing bacteria in the plaque biofilm. The slime barrier limits the extent to which chemical agents can be expected to control plaque biofilm. In other words, chemical agents delivered locally are limited in effectiveness by the slime layer. Therefore, the slime layer must be mechanically removed. Microbial reservoirs are a source of continued infection. It is a place that allows pathogens to hide and escape mechanical removal. This hidden bacteria can then repopulate pockets more quickly and reinfection occurs. Bacteria may live in protected sites such as the furcation, on residual calculus deposits, within the connective tissue, in dentinal tubules, and irregularities in the tooth surfaces, or bulky restoration margins. At this point, there is no chemical agent that can control periodontitis. There are a number of different chemical agents that can be used as part of comprehensive treatment for patients with periodontal diseases. In other words, chemical agents alone cannot control periodontitis, but can be used as adjuncts to comprehensive treatment. Examples of chemical agents are antibiotics, antiseptics, fluorides, metal salts, or oxygenating agents. Examples of systemic antibiotics studied for use in periodontal care are penicillin and amoxicillin, tetracyclines, erythromycin, metronidazole, clindamycin. Systemic antibiotics are not indicated for chronic periodontitis, but are useful in the treatment of aggressive periodontitis. According to the Centers for Disease Control, antibiotic resistance is a serious public health problem throughout the world, and the problem is increasing in scope. A second reason for avoiding systemic antibiotics is that in most patients, plaque-induced gingivitis and chronic periodontitis respond well to conventional periodontal therapy, which means mechanical removal. Antibiotics frequently are, however, indicated in the treatment of patients with aggressive periodontitis and other rarer forms of periodontitis. The use of tetracyclines has become popular because tetracyclines have properties that make them attractive for use in periodontitis. Higher concentrations of the drug concentrate in the gingival crevicular fluids and are effective against AA. They also inhibit the action of collagenase, which is one of the enzymes responsible for breakdown of the periodontium in periodontitis patients. This diagram shows that when a patient is diagnosed with periodontitis, the cascade of activity that follows a diagnosis of chronic periodontitis versus aggressive periodontitis. Controlled release delivery devices are antibacterial chemicals which are embedded in a carrier material. The device is placed directly into the periodontal pockets. The carrier material dissolves slowly, producing a steady release of antimicrobial agents over a period of several days within the periodontal pocket. Chlorhexidine and tetracycline family drugs are currently used. The goal of these devices is to subject subgingival bacteria to therapeutic levels of a drug for a sustained period of a week or longer. They result in a small increase in attachment level in a periodontal pocket. When used along with periodontal instrumentation, they can result in both an improvement in probing depth reduction and a clinical attachment gain. These mechanisms are tetracycline hydrochloride containing fibers, which are no longer currently used, minocycline hydrochloride microspheres, doxycycline hyclate gel, and chlorhexidine gluconate chips. See your book for more information on how to use each of these controlled release mechanisms. Cosmetic versus therapeutic mouth rinses. What is the difference between them? Cosmetic mouth rinses cover up or mask odors, but do not control oral diseases such as gingivitis. Therapeutic mouth rinses are discussed here, and those are the rinses that decrease dental plaque enough to also decrease the severity of gingivitis. Note that there are also therapeutic mouth rinses that can benefit the patient in other ways, such as decreasing the risk of dental caries. The characteristics of an ideal mouth rinse are efficacy, which means that they kill or inhibit periodontal pathogens. Stability means that they have a reasonable shelf life. Substantivity means that they are retained in the oral cavity and released slowly over several hours with continued effect. And safety, which means that they do not produce any harmful effects on local tissues or systemically. Mouth rinses containing chlorhexidine. They are available only by prescription in the U.S. and are proven to reduce gingivitis in numerous studies. In the U.S., these prescription rinses contain 0.12% chlorhexidine gluconate, but higher concentrations are available in some other countries. It has been found that chlorhexidine can reduce the overall severity of gingivitis by about 50% when used as directed. Bactericidal agents effective against both gram-positive and gram-negative bacteria. It binds with hard and soft oral tissues and is slowly released over several hours in a concentration that kills bacteria and has a very low level of toxicity and shows no permanent retention in the body. Its primary mechanism of action is the disruption of the integrity of the cell walls of the bacteria. Current recommendations for use of the 0.12% chlorhexidine gluconate are to rinse with 1/2 ounce for 30 seconds twice daily as part of the patient's routine self-care program. Patients who would benefit from chlorhexidine are special needs, post-surgical, patients with candida, patients with dental caries, and patients with oral piercings. Mouth rinses containing essential oils. Essential oils have been used as active ingredients in mouth rinses for many years. The chemical agents include thymol, menthol, eucalyptol, and methyl salicylate. They are available over the counter in products such as Listerine and have received the ADA seal of acceptance for effectiveness against gingivitis. They are proven to reduce gingivitis by 35%. They are, however, less effective than chlorhexidine and less expensive than chlorhexidine. The relative effectiveness is not clear. It depends on which study you read or believe. The use of povidone iodine as a mouth rinse. It is an antimicrobial agent that has been used in medical practice as a pre-surgical scrub for skin disinfection, has been studied as a mouth rinse and found comparable in results to some other chemical agents, but concerns relating to the safety of daily use have been raised. Patients who have a sensitivity to iodine or allergies to shellfish should not use this product. Also, patients with thyroid dysfunction or women who are lactating or pregnant. No chemicals are completely safe for all patients. Most mouth rinses have produced unwanted side effects in some patients. Possible side effects of chlorhexidine include allergic reaction, extrinsic staining of teeth, discoloration of the tongue, alterations in taste sensation, and an increase in calculus formation. Possible side effects of essential oils include a burning sensation in the mouth, a bitter taste, and drying out of mucous membranes. Problems with inactive ingredients in mouthwashes have to do with the high levels of alcohol and should be avoided in patients addicted to alcohol. Mouth rinses with high levels of sodium should be avoided for certain patients with hypertension. ADA classification of toothpaste. Anti-tartar, caries prevention, cosmetic, gingivitis reduction, plaque formation reduction, and reduction of tooth sensitivity. The active ingredients in these products are pyrophosphates, stannous fluorides, triclosan, and zinc citrate. See your book for more information on these active ingredients. Toothpaste appeared to be an ideal delivery mechanism for chemical agents. It is reasonable to expect that additional research will lead to new developments in this area. Chemical agents may be used systemically and topically to control dental plaque biofilm. Mouth rinses and toothpaste are local delivery mechanisms for reduction of gingivitis and control of plaque biofilms. This concludes Perio Chapter 28, Lecture 1.